Over half of all women of childbearing age have fibrocystic breasts, meaning that the breasts are dense and they have some non-cancerous breast lumps that can become tender and swollen during menstruation. Now, dense breasts make it difficult to distinguish malignancy with mammograms. We've talked about this before.
Yes, it becomes a real problem. It's sort of like flying over the North Pole looking for polar bears, because the density of the tissue in fibrocystic disease is very much the same as the density of a cancer. So on X-ray, they show up a lot of the times identical, and it causes lots of problems with early recalls and a lot of additional testing.
So we're going to talk about dense breasts and what fibrocystic breast disease is and how it relates to breast cancer. So what is fibrocystic breast disease?
Yeah, well, what happens is during the menstrual cycle, Vicki, we have in the first part of the cycle an increase in the level of estrogen and estradiol particularly, and that causes a growth of breast tissue. And if the growing gets ahead of the receding part of the cycle, which happens in the second part of the cycle when there's progesterone around, we can form too much in the way of growth that leads to cysts in the breast that can become nodular and painful. And that's what happens. Particularly
so a cyst is something that has fluid in it as opposed to a solid mass that would be a tumor.
And you can differentiate them pretty easily with ultrasound, which is why I prefer to do it that way.
Don't MRIs do that also?
MRIs do too, but MRIs are pretty expensive. You're looking at a test there that can cost $1,000 or $2,000 compared to a couple of $100 to do an ultrasound.
I think another good thing for people to know is that if you do have fibrocystic breasts, and you have these because you have these little cysts, that they're movable and they're not firm and stuck.
They don't
like
stick to
a
the
mass
skin.
does. Yeah,
not so much, but they can be virtually indistinguishable from a cancer. So they're important to be able to know about and to do something about, because you can treat people for this by modulating their hormones. And what we usually do is we're looking at the salivary levels of estrogen and progesterone throughout the cycle. And if there's a deficiency of progesterone, which there usually is in this setting, we can just give a little bit of topical progesterone cream onto the breast during the last half of the cycle, and it usually solves the problem.
So is fibrocystic breast disease a risk factor for breast cancer?
Absolutely. It's a serious risk factor for breast cancer. But there are a whole lot of different grades of fibrocystic disease. Very mild fibrocystic disease, maybe the risk goes up 1.5 or 2 times above normal. In the most severe forms of fibrocystic disease, where there's a lot of growth of new cells, and those new cells are abnormal-looking cells that have dysplasia, the risk may go up to as much as 5 or 6 times.
Well, since this seems to be influenced by hormones, does this mean that when we go through menopause that they go away?
Yeah, a lot of the time that's exactly what happens, is they get a lot better. So if you have problems with too much estrogen in your system that can cause fibrocystic disease and uterine fibroids, those usually clear up within a year or 2 of having gone through the menopause.
So do they need to be diagnosed? I mean, this article that we were reading, of course, the radiologists recommend doing mammograms, but mammograms give you radiation. It seems like that would increase the risk of it becoming malignant.
Right, and it's very difficult to differentiate them as well. So we need a better test to be able to differentiate it. And of course, we have
Otherwise,
it.
we're looking for those polar bears.
Yeah, exactly. And so there is a test out there, but it just hasn't made it to the mainstream. And the reasons are just silly. We're looking at breast thermography, which is a way of differentiating on the basis of physiology of how the breast works, rather than looking at the anatomy, which is really difficult to differentiate when you're doing a mammogram.
Especially since, the radiologists are recommending doing these tests starting at 35, which is a really dangerous time to introduce this type of radiation. And if a woman got a breast thermography, there's no radiation with breast thermography.
Yeah, and it differentiates fibrocystic breasts from breast cancers very easily, because it's a test of physiology rather than test of anatomy.
It's just that it's not radiation, so it doesn't get in the radiologist's journal.
Exactly. So there was a study that was done that was in one of the societies, in the Radiology Society of North America in December of 2013 that quantified the amount of breast density to the risk of developing breast cancer. And it was very interesting to see that they could do that. So it's interesting, but at the same time, we're looking at a test that's related to mammography. And it seems like what we're trying to do in the mainstream of medicine is refine the test of mammography rather than look for a new test, which does it in a different and better way. So we come up with all these ideas and spend a lot of research on things that really are silly because we're running them into the ground and they aren't that good a test, particularly for people under the age of 50.
Wouldn't just a physical breast exam pretty much tell a woman if she had dense breasts or not?
Yes, you'll know if you have dense breasts that way, but you can't differentiate whether they're caused by fibrocystic disease or by cancer. Although in general, cancers are painless, and fibrocystic disease, it's usually a tender situation, but you can't bank on that.
Well, how much of the time do dense breasts become malignant then?
Well, it depends on the degree of how much fibrocystic disease there is and how much inflammation there is. And when you're looking at severe fibrocystic disease, the risk is up as much as 6 times normal. And if you're looking at the milder cases, maybe it's just maybe a small percentage of the time, maybe twice as much.
So is there anything that a person can do about it?
Well, I think the workup is the first thing. I think we ought to bring breast thermography forward as a technology. It doesn't make much sense to do baseline testings with mammograms in young women because we know it causes breast cancer. The breast thermogram differentiates it. The MRI would be a great test too, and there's no radiation from that, but the test is very expensive, so it's not practical. So we're looking at this whole business of fibrocystic disease. We have the answers today. If we use the technologies and what we know about endocrinology to balance hormones better, this would be a problem that would be easy to resolve and lower the incidence of breast cancer substantially.
Well, women that are under 35 that do end up with breast cancer from dense breasts, usually that's a more aggressive type of cancer, isn't it?
Yes, and anytime you have young women with cancer, you have a more aggressive cancer that's more likely to metastasize and to recur.
And this is why people get all up in arms and like, let's start doing mammograms earlier. But if you've listened to what we're talking about, that's not the choice.
No, it's not the best choice. And so we need to evolve and start looking at the newer technologies that are available. And by the way, breast thermography is approved by the FDA. It was in 1982 as an adjunct to mammography. So we should be adding that to our armamentarium because we need all the help we can to protect women from developing breast cancer when we have something like fibrocystic disease that's quite treatable.